My name is Dr. Sean Eastwood. I'm here with Lauren to explain kinesiology. It's also referred to as stress response testing or manual muscle testing. It's a test of neurological function or dysfunction based on the strength of a muscle. So I'm just going to get Lauren to hold an arm nice and straight, nice and strong. Don't push up, just hold. And that's a very nice, strong, crisp muscle test. I'm then going to touch the very top vertebra, which is C1. Nice and straight, nice and strong for me. And that test, when I'm touching C1, is going from strong to weak. That's a sign that there is neurological dysfunction at that level of the spine, which means that the vertebra is misaligned. Now, because we have a digital feedback mechanism on the body of strong or weak, we can lay the chiropractic model over the top of that acupuncture meridian system. So, there's acupuncture points for emotions, nutritions and toxins. There's also brain points for the cerebellum, the motor cortex, all these other parts of the brain, so we can get a much better in-depth knowledge of why the vertebra is misaligned. So if I now touch the very top vertebra and it goes weak, if Lauren puts her hand on her forehead, that's acupuncture points for emotion. That's why we touch our forehead when we're under stress, if we see a motor vehicle accident, something like that. And now I retest that muscle test and that goes very strong. So that's an indication that one of the reasons why that vertebra is misaligned is in a reflex to an emotional trigger. The reason that I find manual muscle testing, stress response testing, kinesiology so effective in diagnosis is because it's examining the patient's body and the patient's nervous system and their response to stress or stimulus by touch.